The excess fat accumulating inside your liver cells functions far beyond standard harmless obesity parameters, operating as a biological factory continuously flooding inflammatory cytokines that silently destroy your endothelial lining, harden your peripheral carotid arteries, and suffocate your systemic energy. Today, I will expose the ultimate life-saving food blueprint that aggressively vacuums out liver fat, shatters deep insulin resistance, and naturally repairs your hepatic tissue right from your daily dining table. When hepatic tissues experience chronic fatty infiltration, your entire metabolic architecture enters a catastrophic domino loop of systemic collapse, demanding a highly strict, evidence-based geriatric nutritional intervention framework to permanently rebuild your vascular network. The primary metabolic error at middle age involves falsely assuming your physiology remains perfectly intact before liver enzymes spike, allowing toxic visceral fat to covertly destroy your hepatic globule architecture. The initial hazardous warning targets overloading your system with concentrated free fructose from the daily habit of drinking extracted fruit juices. You assume juicing delivers clean vitamins, but mechanical extraction completely discards the protective fiber matrix, leaving a liquid fructose tsunami. This liquid sugar bypasses peripheral muscle cells entirely, traveling directly to your liver at extreme velocities. This biological process forces your liver to aggressively accelerate de novo lipogenesis mechanisms, transforming your hepatic parenchyma into a stagnant reservoir of hardened saturated fats that continuously triggers chronic inflammatory cascades throughout your circulatory pathways over lifespan. Warning number 2 focuses on the direct destruction driven by industrial trans fats from reused cooking oils tearing your endothelium. If you find these medical insights truly meaningful, please click like and subscribe right now to motivate our team in producing more valuable health videos for everyone. As these dangerous fats flood your circulation, they suffocate your liver cells, driving liver enzymes to spike double while triggering acute vascular inflammatory updates during early morning hours. Warning number 3 targets the severe destruction driven by toxic alcohol molecules, disabling the mitochondria inside your liver cells. Absorbed ethanol converts directly into acetaldehyde, a potent chemical toxin that completely paralyzes all of your liver's natural fat-clearing mechanisms. Your liver loses its biological capacity for self-repair, allowing visceral fat plaques to anchor tightly over hepatic structures day and night, releasing continuous inflammatory cytokines that destroy your vascular endothelium. The urgent intervention requires entirely crushing alcohol intake to grant your liver biological space to recover elasticity. Core benefit number 1 of your recovery menu delivers the vital biological energy from rich monounsaturated fatty acids concentrated inside extra virgin olive oil. The active oleocanthal component inside olive oil functions intensely as a potent natural anti-inflammatory agent, clearing liver fat while smoothing your endothelial lining. Maintaining the daily protocol of drizzling 2 teaspoons of raw olive oil directly over your steamed green vegetables supplies your system with maximum healthy monounsaturated lipids. It aggressively reduces your bad LDL cholesterol metrics, halts hepatic tissue fibrosis progression, and accelerates the evacuation velocity of stagnant visceral fat accumulations. This represents the supreme metabolic strategy under modern American geriatric neurology frameworks, shielding cellular membranes against oxidative stress while maintaining long-term baseline blood pressure stability. Core benefit number 2 originates from the dense cascade of pure omega-3 fatty acids distributed by fatty fish like wild salmon or mackerel. The active EPA and DHA components function effectively as natural biological detergents, directly attacking and shattering the de novo lipogenesis cycle triggered inside the liver by toxic fructose. Consuming wild salmon 3 times weekly supplies the essential raw materials to rescue hepatic cells suffocated by toxic lipid layers, fully restoring your body's natural detoxification capacity. Concurrently, the anti-inflammatory fatty acids of omega-3 enter your circulation to reduce platelet aggregation metrics, successfully clearing fragile atherosclerotic plaques expanding inside your carotid pathways behind the neck. This biological sequence blocks remote risks of new blood clots, migrating upward to launch catastrophic territorial ischemic strokes or silent white matter lesions. This serves as your comprehensive metabolic shield, protecting your endothelium, successfully sustaining peak physical clarity and total long-term physical independence. Core benefit number 3 stems from the dense network of polyphenols and soluble fibers found inside dark leafy greens. Please click like, subscribe to the channel, and drop your personal health updates in the comments below to motivate our upcoming clinical lessons. As fiber arrives inside your stomach first, it constructs a dense biological gel mesh coating your small intestinal mucosa, severely delaying sugar absorption, maintaining perfect blood sugar control, while lifting immense workloads straining the liver. Furthermore, natural nitrate compounds concentrated within spinach or kale convert directly into active nitric oxide gas inside your vascular lumen. Nitric oxide gas functions effectively as the body's most potent natural vasodilator, instantly dilating peripheral microvessels while completely lifting early morning cerebral vascular spasms, keeping your blood pressure profiles safe, entirely erasing mechanical shear stress, destroying your carotid endothelium behind the neck channels. Core benefit number 4 stems from potent anthocyanin antioxidant compounds concentrated inside dark berries like organic blueberries or strawberries. These specific polyphenols possess superior biological capacity, crossing protective endothelial barriers to actively neutralize aggressive free radicals ravaging your hepatic tissues. Integrating a small handful of fresh berries into your daily snacks clears low-grade systemic inflammatory agents, boosting peripheral muscle insulin sensitivity by up to 30%, shattering the vascular inflammatory loop over lifespan. Core benefit number 5 focuses on the high volumes of essential potassium and magnesium minerals distributed by organic raw nuts like almonds or chia seeds. Potassium minerals function effectively as a natural biological counterweight, forcing kidneys to flush out excess sodium, decompressing stagnant circulatory volume. Concurrently, magnesium directly coaxes smooth muscle cells lining your arterial walls to relax, completely neutralizing volatile dorm blood pressure spikes, while supporting hepatic cells to restore peak metabolic function. Actionable management step number 1. To personally rescue your hepatic parenchyma from toxic fat accumulation requires implementing the sequenced fiber-first dining protocol. During every single meal, you must consume a plate of steamed green vegetables rich in soluble dietary fibers first, before touching clean proteins or complex carbohydrates. This protective biological gel mesh coating your small intestinal mucosa completely blocks sudden glucose tsunamis from releasing into circulation, locking sugar stable while removing the burden of abdominal fat storage. Actionable management step number 2 is exceptionally powerful, incorporating the execution of a continuous 15-minute stationary calf raise routine immediately following your meals. This seated movement intensely activates your lower leg soleus muscle, the singular muscle mass possessing a unique biological capacity, automatically drawing glucose directly from circulation to burn for physical fuel completely independently, requiring zero assistance from insulin keys currently resisted by your cells, entirely calming cellular insulin resistance, destroying your liver. Actionable management step number 3 delivers extreme clinical efficiency to slow liver fat accumulation, incorporating an organic apple cider vinegar protocol 15 minutes before dining. Dilute 1 teaspoon of raw apple cider vinegar into a large glass of warm water, consuming it through a straw to safely safeguard your tooth enamel. The active acetic acid component functions effectively as a natural inhibitor, slowing down starch-digesting enzymes, blocking sudden glucose tsunamis from releasing into circulation, while boosting peripheral muscle insulin sensitivity by 30%. Actionable management step number 4 focuses on optimizing your nocturnal deep sleep architecture by proactively restricting fluid intake during evening hours. Please subscribe and like this video right now to join us in spreading authentic, meaningful healthcare solutions across the community. Restricting fluid consumption past 8 p.m. entirely eliminates disruptive nocturnal urination episodes that fragment sleep, granting your brain's lymphatic system time to clear toxic amyloid beta, protecting your white matter. To successfully transform today's complex scientific knowledge into a practical protective weapon, I want to provide a concise clinical communication protocol consisting of 3 strategic queries to discuss directly during your routine medical checkups. When you confidently present these highly informed academic queries, you force the physician to concentrate on constructing a personalized prevention framework tailored precisely for your physical status, completely eliminating vague guesswork, allowing you to actively master your cerebral vascular architecture from afar. Strategic query number 1 you strictly need to present to your healthcare provider is based on my hepatic fatty infiltration status and current insulin resistance signs. What are the exact target blood pressure metrics, safe liver enzyme thresholds, and optimal hemoglobin A1C scores I must maintain during home logging? This crucial query forces the clinical conversation toward establishing a clear biological milestone, allowing you to accurately evaluate the real-world efficiency of your daily soleus muscle raises and dietary sequencing. Advanced specialized diagnostic neuroimaging evaluations function is the supreme key to thoroughly map out fragile atherosclerotic plaque architectures hidden behind your cervical vessels. Geriatric neurology strongly recommends undergoing a duplex carotid ultrasound evaluation behind the neck to precisely measure your intimomedial thickness, IMT parameters over aging lifespan. Strategic query number 2 you strictly must discuss during your clinic appointment is given my structural organ risks driven by chronic inflammatory cytokines from the liver. Am I an appropriate candidate to undergo a duplex carotid ultrasound to measure intimomedial thickness, IMT, to screen for fragile atherosclerotic plaques? This question advances your medical dialogue into specialized neuroimaging dimensions, helping identify early embolic stroke threats before vulnerable plaques rupture and destroy neurons. Strategic query number 3 you strictly need to ask to finalize your protective shield over your central nervous system is on my high-resolution brain structural MRI scan slices. Are there any visible microscopic vessel damages or silent lacunar infarct lesions expanding inside the deep cerebral cortex frameworks? Presenting this question demonstrates that you represent a highly informed individual possessing profound wisdom during your personal journey to safeguard your physical freedom and cognitive clarity across lifespan, shielding your intracranial white matter from afar. I want to leave you with a profound clinical philosophy of geriatric medicine, the devastating complication you successfully prevent through your intelligence and consistent daily movement will never make dramatic breaking news. A sudden stroke or cognitive decline pushed back from afar carries no intense resuscitation moments inside an emergency operating room. It remains completely quiet. The beautiful outcome of that prevention is just an ordinary morning where your brain stays sharp, your steps remain steady, and you continue enjoying warm conversations with family. You do not need to live under passive anxiety. The core principle older adults must firmly memorize is the long-term biological accumulation effect of subtle metabolic errors. A minor nutritional mistake, like drinking a sweet extracted fruit juice daily or neglecting dark green vegetables first, never triggers acute hepatic fibrosis inside a resilient 30-year-old physiology. However, when your framework navigates past the critical 55 milestone, your internal lipid evacuation velocity and vascular endothelial elasticity have already dropped heavily due to chronological aging. At this stage, those exact visceral fat plaques covertly accumulating over decades erupt into aggressive hepatic failure pathologies, completely destroying your entire metabolic baseline. The true clinical power to shield your vascular lumen resides entirely inside your consistent daily discipline over small nutritional habits at home, completely calming cellular insulin resistance from a foundation. Widespread patients dangerously delay lifestyle modifications, waiting until severe metabolic complications from fatty liver disease erupt into irreversible cirrhosis necrosis before panicking and seeking heavy chemical prescriptions. This represents hazardous vascular suicide. Write down these 5 natural methods inside your wellness journal to serve as your permanent operational roadmap, reclaiming absolute master control over your biological destiny. The compounding effect and a small habit extending from day to day creates a highly powerful anti-aging clinical intervention over time, successfully preserving the non-stick integrity of your microvascular networks, nourishing your brain and heart. A sharp cognitive mind free from plaques and complete physical independence represent your most priceless assets to thoroughly enjoy your peace and happiness alongside family past age 60. You possess the biological power to effectively shatter the destructive cascading loop driven by fatty liver disease through improving lifestyle factors just 1% daily, constructing a dramatic physical transformation. The devastating complication you successfully prevent through your intelligence and consistent daily movement requires clearing your peripheral glucose begins directly from your dining table, lifting the immense workload straining your pancreas without chemical costs, coordinating your soluble dietary fibers, and executing your moderate soleus muscle calf raise routines represents your ultimate natural weapon to clear glucose, neutralizing volatile door and blood pressure spikes, perfectly shielding your entire microvascular networks to remain fluid and rhythmic across your lifespan. Share this educational video link with the people you care about most, a spouse living alongside you, an aging parent, or a sibling over middle age who needs this vital screening data. The individuals who are at the highest statistical risk of facing this chronic lipid and sugar-induced vascular storm will likely never search for these advanced clinical studies online. Your small act of digital sharing today might become the exact reason someone's life and circulatory pathways are saved, perfectly preserving their independent living. When liver mitochondria evacuate stagnant fatty acids utilizing the active oleic compounds inside olive oil, hepatic tissue completely escapes destructive cytokine inflammatory cascades. Implementing the sequenced fiber-first dining protocol and executing your moderate soleus muscle raises represents your ultimate natural weapon safeguarding your brain cells against vascular dementia. To kickstart your hepatic fat clearance campaign, I have structured an explicit action blueprint spanning from day 1 to day 7 sustainably. Across this initial week, your supreme objective requires completely crushing 3 nutritional toxins, refined fructose from fruit juices, industrial trans fats from fried items, and toxic alcohol blockages. Drizzle 2 teaspoons of raw extra virgin olive oil directly over your steamed green vegetables, consumed first during your breakfast meal to permanently neutralize volatile post-meal blood sugar spikes. Concurrently, within this initial 7-day block, fully execute your continuous 15-minute stationary calf raise routine immediately following your dining schedule. This seated movement intensely activates your lower leg soleus muscle, the singular muscle mass, automatically drawing circulating glucose directly from your bloodstream to burn for physical fuel independently without requiring insulin keys, entirely removing the burden of visceral fat storage while drawing hemoglobin A1C back into safe zones. Transitioning forward into the day 8 to day 21 phase, we actively upgrade your whole food Mediterranean diet built around rich cascades of pure omega-3 fatty acids. Multiply your consumption of fatty fish like wild salmon or mackerel up to 3 times weekly. The active EPA and DHA components function effectively as natural biological detergents, directly attacking and shattering the de novo lipogenesis cycle, rescuing hepatic tissue cells from the suffocating pressure of systemic inflammatory cytokines. Simultaneously inside this phase, implement your organic apple cider vinegar protocol 15 minutes before your main meals. Dilute 1 teaspoon of raw apple cider vinegar into a large glass of warm water, consuming it through a straw to safely safeguard your tooth enamel. The active acetic acid component functions effectively as a natural inhibitor, slowing down starch-digesting enzymes, preventing sudden glucose tsunamis, while boosting peripheral muscle insulin sensitivity by 30%, shattering the vascular inflammatory loop. Entering the final day 22 to day 50 stabilization block. Integrate a small handful of fresh berries like organic blueberries or strawberries daily into your snacks. Potent anthocyanin antioxidant compounds cross protective cellular barriers to actively neutralize aggressive free radicals ravaging your hepatic tissues, drawing your liver enzymes back to safe zones. Concurrently, optimize your deep sleep architecture by restricting fluid consumption past 8 p.m. to grant your microvascular vessels biological space to recover elasticity. Within this exact timeline, strictly monitor your personalized target hydration metric of 30 milliliters per kilogram of body weight daily. Completely reject waiting for your blunted aging thirst sensors to activate. Proactively distribute small sips of warm water consistently across your daylight hours to keep your circulation perfectly fluid, successfully blocking dangerous early morning blood clot aggregation events inside your carotid pathways behind the neck. When you consistently maintain the scientific 50-day action blueprint, profound biological transformations unfold deep inside your physiological framework. Your hepatic parenchyma completely escapes the suffocating pressure of saturated visceral fat plaques, drawing your liver enzymes back to absolute safe zones. Your pancreas reclaims its biological mechanical vitality, volatile post-meal glucose spikes are entirely neutralized, restoring healthy longevity paths and absolute physical freedom across your lifespan. Coordinating fiber-first dining choices, sustaining regular soleus muscle exercises to rescue your vessels, and presenting 3 strategic diagnostic imaging queries during hospital checkups constructs your multi-layered defense shield. This protocol keeps your cardiovascular fluid networks perfectly fluid and rhythmic across lifespan, entirely removing systemic oxidative stress off your renal basement membranes, successfully halting catastrophic end-stage renal failure threats. The corporate medical complex harvests massive financial profits exclusively when you stay sick consuming pharmaceuticals, not when you maintain an independent, healthy body through self-care. That remains the supreme reason Boston Community Health exists, to fully restore absolute autonomy over your vascular and metabolic destiny right back into your own hands. Sudden hypertensive spikes driven by long-term hepatic fatty infiltration, releasing continuous systemic inflammatory cytokines, frequently trigger deep, silent lacunar infarct scarring inside your cerebral cortex architectures. These highly destructive imaging lesions expand completely silently without causing sharp external facial drooping symptoms, building a hazardous vascular suicide trap that slowly strips away your sharp cognitive mind and independent living. Utilizing an advanced functional diagnostic screening via high-resolution duplex carotid ultrasound behind the neck captures your intimomedial thickness IMT profiles, which strictly must remain below the 1 millimeter boundary. When crossing this threshold, it flags severe arterial wall thickness thumping with dangerous mechanical shear stress, where fragile plaques easily rupture their fibrous caps to launch early morning blood clot aggregation events. A high-resolution brain structural MRI scan functions as a supreme diagnostic imaging solution to permanently expose silent lacunar infarct scars expanding inside your deep cerebral cortex framework. These tiny lesions unfold completely silently inside a quiet room without showcasing physical paralysis external symptoms, yet covertly fracture vital neural signaling transmission over chronological decades, heavily accelerating vascular dementia. Transform today's natural nutritional checklist and soleus muscle calf raise routines into your permanent operational roadmap at home for natural vascular clearance. This mechanical coordination not only supports hepatic cells to evacuate stagnant visceral fat, but stabilizes your systemic blood pressure profiles, entirely removing mechanical shear stress straining your microvascular networks, nourishing your brain and heart. Mastering your metabolic destiny operates as the ultimate master key, granting aging adults absolute physical freedom without remaining dependent over pharmaceutical lipid-lowering agents, packing toxic side effects, destroying renal health. A medically sound Mediterranean lifestyle prescription, raw olive oil drizzles, and mechanical soleus muscle calf raises construct the most powerful intervention safeguarding your structural metabolic compliance across lifespan. The medical organization Boston Community Health will consistently remain here to deliver the most authentic, scientific, and evidence-based knowledge throughout your health autonomy journey. Our professional mission is to deliver honest, international geriatric knowledge without fear-mongering or commercializing unverified health supplements to help you assume absolute master control over your own medical destiny. Operating as a dedicated clinical practitioner, my most priceless